Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone. This is Bryce Patton. Welcome to the Senior Moment Show. I'm joined here with Sid Roeder today. How you doing, Sid?
I'm doing great. Good to be here.
Oh, it's excellent. We also have a wonderful guest, Dr. Jake Measum. We'll get into him in a second. Sid, I'll turn it over to you for our sponsors.
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anybody who cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. Or lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can call me personally at 435-512-6406.
Excellent. Well, Jake, let's get into you. So, Jake Measum, you're from here in the Valley. You want to tell us a little bit about yourself?
Sure, I'll do the best I can here. So born and raised here in Cache Valley, went to Logan High, Utah State, go Aggies, all the way through there. Really happy to be able to come back to the Valley after my training, and great place to raise a family. Couldn't ask for a better opportunity than to be here.
Oh, that's awesome. So we met a while ago doing outdoor recreation.
Way back. Yeah.
Way back. So what got you into wanting to help people with their pain?
So pain management was really interesting that it kind of went that way. When you go into med school, you don't really, some people have an idea of what they want to do. Most people, it's kind of like, I don't know, we'll just see kind of what happens and what sparks your interest. I seem to have an interest in just people's stories, the experience that people have as they go throughout life with whether it was the psychological issues, the pain issues, their ability to interact with others, their physical abilities. And pain really, for me, was this intersection of all those things. In addition to that, it's a field that's very hands-on, very tactile. You're doing lots of procedures, injections, and so it really provided this area where I got to have the personal interaction, the psychology side, the technical side, the medicine side, kind of all wrapped into one. And that's really where I dove into that. And every single time I learned more about it, it just kind of went deeper, deeper, deeper. And I have become totally obsessed.
So let me ask you this then, Jake. When you're talking about pain and pain management, are you dealing with all sorts of pains, or are you specialized on a specific area? Because I know spine is in the name of the thing.
So absolutely. And so I would say the bread and butter of what I do is spine. We're doing neck pain, back pain, the sciatica, all that stuff, which is the far and away the most common pain type complaints that we see. That being said, we deal with pain anywhere and everywhere. If it hurts, I'll have patients sent to me for it. And that's where I found a lot of what I end up doing is playing detective a lot of the times, where people get sent to me. I saw this person, this person, this person, this person, and nobody knows what it is, but I hurt. And can we figure out what it is?
So I take it then that you're not necessarily prescribing painkillers all the time or doing injections. You're also looking for alternative treatments potentially when you find the cause?
Absolutely. And so I tell my patients half the battle is let's figure out what's going on. Let's figure out where the pain is coming from. And then we can once we know what it is, it's a lot easier to work with and try to find accurate solutions as opposed to just throwing darts at a board blindfolded. And so I would say that's really the crux is figure out what it is, and then we can find solutions. When it comes to medications, pain management, from the 90s and early 2000s certainly got a bad rap with the opioid crisis, opioid prescribing. I think everyone's familiar with how that's turned out so far in the crisis that we're in, from a social health standpoint because of that. And so oftentimes pain management gets kind of lumped into this, they're pill pushers, that's who's prescribing the opioids. While pain medicine is part of that still. There are still patients that need narcotics to function on a daily basis. There's patients that have been on that for 20, 30 years and have a hard time getting off that. It's what allows them to function. Those are things that we still deal with and we work with, but we're constantly trying to find ways to decrease those medications, find safer alternatives, utilize things like injections, like physical therapy, like whatever kind of other complementary or alternative treatments that there could be, whether that's massage, chiropractic. We're interested in people getting better and living functional quality lives.
Oh, that's fantastic. It seems like what you're explaining is you're trying to find the root cause and not just put a Band-Aid over it with the opioids like we had, with the different medications, right?
Absolutely. And that's pain is challenging. There's no way around that. Chronic pain is chronic for a reason. It's challenging, it's debilitating, it has severe psychological effects on people and just their ability to live and interact and just be happy overall. And so finding that root cause, I think, is really important. Now, and there's times that even though you find the root cause, there may not be a perfect solution for it, but at least it gives us a framework of how to move forward and try to provide the best options for people to live that highest quality life.
Oh, that's fantastic.
So I've got a question for you here. I know HIPAA law prevents you from for sure using any names, but
don't get me in trouble here.
Yeah. Is there any story that comes to mind without naming names that you could share where you maybe had really intriguing diagnosis and some interesting therapy? Okay,
so here's one that I, without naming names, but some people may recognize the story. There was about a year and a half ago, there was an incident where a lady, this is in Wyoming, was attacked by a deer in her driveway. Did anybody see this?
Yeah, I saw this.
Okay, so she was attacked by a deer in her driveway while trying to help her dog, and the deer knocked her over, and she ended up having a severe fracture of one of her vertebral bodies in her lumbar spine. And so severely debilitating pain from this. It was a really bad injury. When I first met her, she was in a back brace, in a wheelchair, couldn't get around, and it was I was like, what the heck happened? And the staff told me, and I was like, there's no way, I don't, like, that's impossible. And so sure enough, that's what happened. And so we were able to utilize this great new treatment called Spine Jack, which is a type of vertebral augmentation where essentially you go into the vertebral body through about a couple millimeter incision, and you insert a small titanium jack. It looks just like a car jack. Increase the height of that, backfill it with cement to stabilize it. She came in a wheelchair and a back brace. She walked out. And, and those are just kind of the examples of there's great new technology, great options, and it's just so much fun to see people get those benefits.
Awesome. Thank you, Jake. That sounds very painful. We're already coming up on our first break here. Again, this is the Senior Moments Show. We are sponsored by the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info. This is the Senior Moments Show. Stay tuned. We'll be right back.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
And welcome back to our Senior Moments show. I'm here with Sid, and we are speaking with Dr. Jake Measam. You've been telling us some pretty awesome stories and some info about pain. If any of our listeners want to get a hold of you or want to know, how can they get a hold of you and where are you located?
Okay, so again, thank you so much for having me on. The best way to get a hold of us is telephone, which is 435-932-6125. You can find us on our website, which is utahpaincenter.com. And then we're located at 286 North Gateway Drive in Providence, Utah. So that is where we are at. We would love to have anybody come in and stop by and say hello.
Oh, yeah. So with pain, I mean, pain is rough, it just hurts and everything else. So I imagine a lot of your clients probably put you on a pedestal like you're Superman when you get healing, like that last story we just heard. But besides just like, what are alternative medicine, just besides like, hey, I'm just going to throw pills at this problem, what kind of other options do you guys have?
Well, I first have to push back against the Superman comment. I don't know anything about that.
Oh.
But when it comes to other options, I think having a wide variety of options is crucial. The way that I usually tell patients that, to treat complex problems like chronic pain, you have to hit it from a bunch of different angles. Just like, if you're going to change the engine in a car, you need a whole bunch of different tools. You need a full toolbox. Treating chronic pain, you have imaging, you need medications, you need injections, there's physical therapy, among other alternative treatments. And having a wide array of options, because not all options work for all people. So having those options is really crucial. Some of the great things that I've been utilizing in my clinic are some compounded medications. One in particular called low-dose naltrexone. There's compounded creams, which we have some fantastic compounding pharmacies in the Valley that do a really, really good job at putting together these creams for people that can be nice alternatives for folks who don't want to be taking more oral medications. There's new treatments like ketamine infusions, ketamine lozenges, which is something we could talk about for hours and hours about some of the benefits and the new research in those areas. But I think just great options are out there for people in a wide variety.
So it sounds to me a little bit like, I'm super intrigued, I have to say. You work in a field and it's very faceted, and it sounds to me like you're taking a more holistic approach too, because I can only imagine, especially when people are coming with different pains, one might be interacting with a different kind of pain. So it's like this huge puzzle, and you're putting the pieces together, trying to find the best therapy and pain relief for a patient. I can't imagine how long a visit with you might potentially be.
They take variable amounts of time. Usually we try to fit it into the time slot provided to me by my schedulers. But, we'll do the best we can. It is very much a puzzle, though, which I really like. I think sometimes the term holistic can be utilized in a variety of ways, and, taken in certain contexts of what we do or whatnot. And maybe there's, a bit of a little woo-woo and hand-waving and, magic going
No,
on.
I did not mean
But
that. Holistic, I meant in a looking
Of course,
at the
I
whole.
say this, but I say, very tongue-in-cheek. But I would say we take an approach where we're not one-dimensional. We like to try to have a variety of options because what's not one size fits all. Certainly, the vast majority of what I do and where most of my specialty lies is in doing focused, targeted injections, advanced interventional treatments for the spine, nerves, whatever else is going on there. There's a whole bunch of new technology from an interventional, minimally invasive surgical approach that I think is really where we shine. That being said, I think we do a lot of great stuff as well with the compounded medications, recommending physical therapy, massage, getting people in touch with other practitioners who maybe provide other services for a full, well-rounded approach, doing things like the ketamine infusions, which we've seen phenomenal results with, and there are some great people in the Valley doing phenomenal work with that. So I think it's just that big picture approach and having a viewpoint that it's not one size fits all. Everybody's problems are unique, and the solutions may be unique as well.
So sorry, Bryce, I've got to double up here on the ketamine. I'm not a medical professional, so can you elaborate a little bit on what that does or what it's used for?
Okay, so ketamine is a drug that was developed back in the 1950s and 60s, originally as a anesthetic drug, and we still in the anesthesia world use it very extensively. My base training is as an anesthesiologist, and in that setting I used it very frequently. We've also found, and there's a lot of research to substantiate this, the utilization of it for chronic pain utilization, chronic neuropathic pain, as well as significant mental health issues, anxiety, depression, PTSD, and so it's being utilized in all of these areas quite effectively.
Okay, that's intriguing.
Wow, that's awesome. So, so what is a visit? So they come in and visit you. I mean, are they going to have immediate results, or does it just vary? What is it? What's a timeline to get that pain gone?
Well, Bryce, I tell people that perfection is a rare bird, and usually there's going to be a period of figuring out what's going on. Because most of the time people come to me with complex problems. Sometimes if it's an easy fix, they might feel relief very quickly. Depending on what's going on, we may need to do diagnostic tests. We may need to get more imaging. We may need to do some test injections, trying to just figure out what's going on. I would say most people tend to get relief pretty quickly with what we're doing, whether that's an injection or a medication, and our goal obviously is functionality and quality of life coming from that pain relief. And so as quick as we can do it is how we want to do it.
That's fantastic.
Yeah. Jake, let me ask you this really quick. Is there any, because our program's a little bit more geared towards senior, what are some of the typical things that you see with your senior patients?
So the typical things are, I would say back and neck pain, far and away, are the most common. Knees, hips, all that is certainly, thrown into that melee as well. But as you age, you're going to have degeneration of the spine, whether that's in the low back or the neck, and that's really where we have a huge number of options, some fantastic new technology of how we can treat pain in the spine, that, not using drugs, that gives good quality long-term benefit. Again, my whole goal and nothing, with all of this, and there's nothing that makes me happier than people being able to get out doing what they like to do. I tell people life's worth living. Get out there, do it. There's no reason not to.
Thank you, Jake. We're already coming up on our second break here, but maybe really quickly you could mention the phone number and the address again.
Sure. So the phone number for our clinic is 435-932-6125, and we're located at 286 North Gateway Drive in Suite 201 in Providence.
Thank you, Jake. This is the Senior Moment Show. We'll be right back.
It's It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
And welcome back to our Senior Moment Show. I'm Bryce Patton here with Sid Roeder, as well as our guest, Dr. Jake Measam, with the Interventional Spine and Pain Management Clinic. Jake, thanks for all the information you've given us so far. We appreciate it.
Oh, well, thank you.
Since this show is towards some of our seniors, do you have any tips or suggestions on how to help people maybe prevent this pain in the first place? Is there anything you can really do to prevent some of this?
Primarily to avoid aging.
Okay.
I think that's the most effective.
So I need to look for the fountain of youth.
Generally speaking, yes.
Yeah. Okay.
But all jokes aside, I think the biggest thing and the most important thing moving forward is to keep moving. That people stay active, stay on top of their health. If you stop moving for so long, that's when you get into this hole of immobility, weight gain, problems compound, and it becomes harder and harder to get out of that and to get active again. So I think from a preventative standpoint, motion is lotion. The more you move, keep those joints going. I think that's going to be a good thing. And certainly, if you're going to have aches and pains along the way, that's part of life, and we're happy to help however we can in that regard. And if we can't, make recommendations of somebody who can. But I think the best thing is just to keep moving and enjoying life. If you are in that hole, in that position where it's you're not moving well, you can't do that. That's where I think utilizing pain management and some of those services can be of benefit to try to get you back to that spot where you can get back into that maintenance and preventative mode.
Okay. So would you say, I find sometimes when I work with seniors in my field that generation is oftentimes used to just sucking it up, not complaining about it. Would you encourage people to come in and chat with you to see if there can be improvement, even if they feel like, well, I've had this pain for years, it's not going to go away?
Yeah, and I think that's a very common finding, is that generation is tough. They are stoic, they're resilient, and, the idea of, giving into, something as measly as pain is not in their nature. I would say, be tough, but don't be afraid to utilize the resources that we have to try to, to live the best life you can. What I tell people is if you find that you're not able to do the things that you like to do, that you want to do because of pain, then you should come see me. And we can try to fix that and get you back doing what you want to do. You want to be out on the pickleball court, but you can't anymore because your hip hurts. Let's see if we can do something about that. I mean, be tough, that's fine, but as long as you can do what you want to do, I think that's the goal.
Now, does insurance pay for this?
Generally speaking, insurance does pay for this. Insurance can certainly be challenging and is probably one of the more annoying things about my job. But I would say that most people have, especially with, say Medicare, have great access to these kind of services and treatments.
Oh, fantastic. Can they just give you a call if they wanted to check and see if their insurance would cover it? Mm-hmm. Would that be okay?
Absolutely. So we take pretty much all insurances, even including the VA TRICARE, TriWest for veterans. Mm-hmm. And so I think for the most part we can see anybody, and generally speaking, with few exceptions, we don't need a referral to have them be seen. They can just give us a call and get in, and we can start working with them.
Oh, perfect.
And I can't resist, we're coming up on the end of our show, but I do need to ask, is there another story that you might be willing to share with our listeners that stands out?
I think that another good story is one of a patient who we did a spinal cord stimulator for. And so spinal cord stimulation is an advanced form of treatment where we utilize electricity essentially over the spinal cord to modulate or change pain signals. And this patient was one who came in, and it was kind of the classic picture that I see where it's I've tried everything, I've seen everybody, I've had back surgery, a couple of times, and I just not working, and I don't know what else to do. And so we were able to go over some of the options, try a few injections, which didn't get us quite where we wanted to, and then to be able to use this kind of technology, like spinal cord stimulation, to get benefit is pretty incredible. To see somebody's life change and see them be able to get back into it. This person in particular, loved hiking, wanted to get out, wanted to be outside, and just for the longest time couldn't. And then to be able to have them come back and say, yes, I just did this. I went down to Bryce Canyon. I went down to Zion and was able to do that again. It's super gratifying, really, really rewarding. And then on the professional side, being able to utilize this new technology is a ton of fun. Sounds
good. Dr. Measom, we're at the end of our show, so I'll give you a chance one more time to mention the phone number.
Oh, well, thank you. Hopefully everyone has it memorized by now. It is 435-932-6125, and we are located at 286 North Gateway Drive, Suite 201 in Providence.
Thank you so much for coming in today and spending time with us. This is the Senior Moment Show. We'll hope you tune in again next week.